muscle attachments here. Now, if you've got pain in an area, then more than likely, if you ask the patient to push up on your wrist, they might feel it. Okay, they might not. Like what when he was doing, she was pointing to a middle finger. So if you push up on your middle finger and extend, and it's painful, maybe try that on yourself. Be careful. Middle. Yeah.
Yeah.
Yeah. You feel it?
Yeah.
Okay. So if it's positive, it might not be positive for everybody, but on the studies, I think it's something like 96.8% is on a particular tendon. What's the name of that tendon? Well done. So the ECRB, so extensor carpi radialis brevis. So that's the tendon. So its insertion point is affecting the middle phalanx. So when you resist middle finger extension and it's painful, it's normally the ECRB tendon. It's written a little bit in my book. So you've got pain there. So you know it's from the elbow tendon. If it's negative on the middle finger, negative on the resisted extension, and it's pain around the elbow, it might be coming from your neck, around C6 in your cervical spine. Okay, so just bear that in mind. Tricky one to treat though, yeah, because you think, well, what do you do? Sometimes when you have a steroid, I do recommend a steroid now and again, when the steroid goes in and the needle comes out, when they inject, the fluid comes back along the track line. Okay, rather than going in and dispersing, because it's a conjoined tendon. So you got, it's like 5 tendons becoming one. So it's like an amalgamation of the connective tissue. So it doesn't really absorb the steroid when it injects in. Okay, because where does it go? It's not like injecting to a muscle where it disperses, let's say. Yeah, that sort of thing. So it doesn't always work, and you have to be so accurate, you know, with the injection site. You have to think about the radial head as well. Yeah, just on that. So the radial head, because sometimes, like let's say you've got a child and you pull the child's arm, then the radial head can get. There's a ligament. What's the ligament called where it goes through? The annular ligament. Good. So the annular ligament is like the head goes through and it's around the neck. And sometimes, so that's the annular ligament, and then sometimes the head pulls out. Yeah, so it's almost like a subluxation. Yeah, and then the child has elbow pain. It's not tennis elbow, it's a nursemaid's elbow. Yeah, around the area. And sometimes an osteopath like me would come in and try to mobilize it and almost do this little technique trying to mobilize it back, yeah, to it. Now, if it is middle finger, then what we can do, if we fold one square over the other square, like this, try this if you want to, and then cut out. I actually had on his course, he was like an ex-sort of farmer, and there's no way he gets his hands in here, okay, his fingers, okay, yeah, his hands are so big. I don't even think fit one finger in, okay, like, gee. Yeah. So, 2 height shapes, yeah, and then you can split them. And then what we're going to do is index and middle finger. I know it looks quite cool, this. In reality, it doesn't work very well, okay, because we wash our hands often. And then this tape stays here, but it doesn't stay on for long when you're washing your hands often. Like for me, with the boat race team, if they have, say, pain in the elbow and I'm with them, yeah, we apply it for the event, yeah, out you come, take it off, yeah, when I can shower, I can reapply it because I'm with the team. So if you're full-time with the team, it's fine. If I'm treating you once a week, then I'm not sure if I would include the fingers here. I might. Once I've done that, so we're going to stretch the tendon, so flexion, and then a bit of pronation. And then this would be roughly a size 8, so crossing, no stretch from there. So I'm going to come right up and cross the lateral epicondo, like that, perfect. And then what we're going to do then, we can just leave it like that if you want to, or you can use a smaller one, like a 4, and then apply that over the elbow where the pain is. And then these two will just come across that area like that. The positive about this one, let's say the lady works in an office and it's a warm day. Yeah, she goes in like in a t-shirt or something, and then imagine that she'll walk in and everybody goes, oh my God, what's she done? What's she done to her arm? Yeah, and they'll all become rushing over. Oh my God, what have you done? And you'll be like, oh, well, sit down, let me just tell you all about it. Yeah, and you say about your elbow and the extension. Oh my God, there was a tape, and then at least you can put like Lucy Stein, yeah, a sports massage therapist, 07, yeah, you know, attach a few business cards underneath it, just take one of those. Yeah, but why not? Okay, you know, you could have like your stamp, couldn't you, just like ding, yeah, just stamp the tape. Yeah, easy, innit? Rather than paying all the money. Okay, yeah, you know, a little smiley face.
I've got the smiley.
Yeah. So this would be a tennis elbow taping. If it doesn't affect the middle finger, tape on the dorsal hand. Yeah, so you don't have to worry about this bit and washing, etc. Start here and finish there, so it'll be like maybe a 6. yeah, along that sort of area. Now, so you can do that one if you want to. Now, with a golfer's elbow, so you can choose which one you want to do. So again, the pain is in here. Now, if I said, because there's 5 tendons attaching, there's one tendon in particular, anybody know the name of a tendon? In fact, what are the tendons? The 5 tendons. You can have a roller tape if you name one more. Palmaris longus, good. We're starting on that, we started. So
what is it?
Have a go.
Pass fail. Flexor digitorum, no, flexor carpi ulnaris.
good.
Flexor carpi.
Yes, come on. What's the other bone?
Radialis.
Radialis is 3. Come on. Well done.
Palmaris longus over.
She's resisting against me, so she's pronating, and I'm resisting that. And if you've got a golfer's elbow, you probably find if it's related to that muscle, that's where you would feel it. So think about like electricians, screw, plasterers, things like that. Yeah, that's what. In fact, when I used to do a lot of pull-ups, that movement of gripping, pulling, rope climbing, when you grip and pull, it's almost like a pronation movement. So that would be the pain. The bonus is it's not a long, it's not like the tendons here in the hand. It's a short, stumpy muscle. So if you look at my book, we can just do a short piece of tape. So we don't need a long piece into the hand here. Not everybody has a palmaris longus. Look at your own hand and tell me if you've got one. You got one. Yeah. Yeah. I don't. I think only so many percentage of the population she has. Can you see it sticking out there? Yeah, forms part of the fascia in the hand. You have a palmaris longus one. But everybody has one. It's like a medical test. The doctor will come up to you and go, "You got a palmaris longus?" And you go, "I got no idea." Fail. Go away. Not quite, but yeah. Yeah. So that will be like an anatomical question they will give you. So then you can do the tape in here. So you can decide on that one. Look at, just turn over the page so you can decide which one you want to do. Now a couple more things. Now pain, massage therapists will get pain here. Let's see what you know on this one, okay? So pain is around this area just here. So name the condition, the 2 tendons and the test for roller tape.
Dequivariance.
Okay, who's starting? So you're saying snuff box.
Dequivariance.
Okay,
This
big
one.
curve,
That's the test, isn't it?
The hitchhiker's one, I think it's D.
Okay, yes. I think between you all, you might get it.
Yeah.
Yeah, what is that?
That's not the equation.
Now, if you look, lift your thumb up, finger on you, anatomically be perfect. There, lift up, that's it. Like that. Can you see there's a tendon there? And there's 2 tendons here, it only looks like one, there's 2, and there's the snuff box. The anatomical snuff box, what bone is in there? It's easy, what bone? The scaphoid. Okay, so the scaphoid locates itself within that area. What's that tendon? What's it doing to the thumb? It's extending, and it's a longer one. So it's extensor. What's the medical word for thumb? Pollex. So this is the extensor, pollicis longus, and the one next to it here will be, and also an extensor. This one, extensor, is a shorter one. Pollicis brevis, and then this one is more of an abductor, so that's called the abductor pollicis longus. Okay, so abductor pollicis longus and extensor pollicis brevis are the 2 tendons that go through a sheath here, and then that sheath narrows. Also, medical word for narrowing. Medical word for narrowing. Think about spinal stenosis. So you have a stenosing. The 2 tendons go through an opening. Okay, so it's called as a so the condition will be a teno vaginitis, because the vagina is an opening. So the 2 tendons go through an opening and it's narrowing. So it's a stenosing teno vaginitis. I know it sounds weird. Okay, but it's true. Okay, and then the person who named it is
De Quivarian.
De Quervain or Dequivane, named after a guy called Fritz De Quervain, and he named it in 1895. That's when he named it. And the name of the test that he did is named after an American called Harry Finkelstein. Okay, so the test is called Finkelstein. Harry Finkelstein. Okay, so that's what it's caused. So the pain is over the radial styloid process here. Massage therapist because usually thumbs too much. And the test is this sort of test. Actually, if I do the test, it's Finkelstein. If you do a Zikos test, but who's being picky? Okay. Yeah. So if you wanted to tape this, you just deviate it, and then you tape across here, and then you can put a strip across there. Also, rowers will get what we call a intersection syndrome, where it's like a violin. Okay, so where the tendon crosses another tendon and it rubs it. When it rubs it, you get this reaction of intersection syndrome, where the two tendons are crossing over. And then you get this swollen area, and then when you put your fingers on it, it goes like a creak. Okay, so you get an obvious tendinopathy in that area. Yeah, just there. Just here. Alright, so again, you can just tape it. So you decide which one you want to do on there.